All right, today we're talking about something that's a real game changer, a homegrown AI platform that's not just making small improvements to healthcare in Africa, it's completely reinventing it from the ground up. Let's get into the story of Nyla AI. So, I want you to think about this for a second. The health apps on your phone right now, sure, they track your steps, maybe your calories, but do they really get you? Do they know the difference between fufu and ugali? Could they give you health advice in Yoruba or Swahili? For most of us, the answer is a hard no. Well, here's the thing. That's not just a what if anymore. For millions of people across Africa, this kind of deeply personal, culturally aware healthcare is actually starting to happen. It's being built right now, specifically for the continent. Now, to really understand why this is such a massive deal, we first have to get a handle on the situation on the ground. Nyla AI is stepping into a world with some very specific, very tough, and very connected challenges. And what you've got to understand is that these aren't separate issues. They all feed into each other. Having limited access to doctors gets even tougher when there's poor data infrastructure. And that lack of data gets more complicated when you have this incredible diversity of languages and cultures, right? A one-size-fits-all solution just won't work. What you end up with is a system that really struggles to give people the kind of personal, proactive health advice they need. So it was right in the middle of these gaps that a new vision started to take shape. A vision to build something not just for Africa, but something that comes from Africa. And this right here, this is Nyla AI's mission. Just look at those three words. Proactive. Not just waiting for things to go wrong. Accessible, so everyone can use it, not just a select few. And powered by intelligence, using tech to fill in those gaps we just talked about. I mean, that is a powerful and ambitious goal. So, what is Nyla AI? Exactly. It's a platform built by an AI research company called Nuvo AI, and the key phrase you've got to remember is tuned to local realities. This isn't just some global app with a few words translated. No way. This is a whole system that was built from day one with a deep understanding of local diets, cultures, and the way people live. Now, here's where it gets really interesting. Nyla isn't just a single app. It's a complete three-part ecosystem. It's designed to connect every single part of the healthcare journey. Let's break down what that means. First up, there's the part for you and me, for the individual. The Nyla mobile app is meant to be your personal AI health sidekick, living right there in your pocket. And this is where you really see that local focus shine. You get the instant medical guidance from an AI chat, you get all the specialized health tracking, but the absolute game changer is the smart nutrition analysis that actually understands local African foods. That is personalization on a whole other level. Okay, so that's part one. Part two of the ecosystem is for the clinics and hospitals. Nyla has a really powerful platform designed to help them run a whole lot smoother. This is all about streamlining the back end of healthcare. It automates things like booking appointments, managing staff schedules, and it even uses AI to generate reports and analytics. The idea is to reduce all the chaos and help clinics run way more efficiently, which, frees up doctors and nurses to actually focus on their patients. And then we have the final piece of the puzzle, the pharmacies. This is the part that connects the diagnosis and the treatment directly to the medication itself. Just think about how this works. An AI that can scan a prescription, intelligently manage inventory so drugs are always in stock, suggest alternatives if needed, and even connect with delivery services. It closes the whole loop, creating this seamless flow from your phone to the doctor's clinic and finally to the pharmacy. So, you're probably asking, how does Nyla pull all this off? Well, the magic, the real secret sauce, isn't just the tech. It's where the technology gets its smarts from. This slide pretty much says it all. A generic health app might be trained on Western data and tell you to eat more kale. But Nyla understands the nutrition in local foods like amaranth greens or cassava leaf and gives you advice that actually makes sense for what you eat every day. It's trained on local African health data, not data sets from somewhere else. This isn't just a small tweak, it's a fundamental change in how AI thinks about health. So let's peek under the hood for a second. At the heart of it all is a powerful AI engine that's multimodal. It's a fancy word, but it just means it can understand not only text, but also your voice and even images, like a photo of your meal. Then you've got a localization layer that helps it speak different African languages. On top of that, you have the special health models trained on all that regional data. And finally, the whole thing is wrapped up in a secure, encrypted system to keep everyone's data safe. With a foundation like this, Nyla AI is basically perfectly positioned to jump on a massive opportunity and really start to shape a new future for healthcare on the continent. By 2030, Africa's healthcare market is projected to be worth a staggering $259 billion. And let's be clear, that's not just a business number. That number represents a massive, growing human need for better and more accessible health solutions. And Nyla has a direct path to meet that need. We're talking about a potential market of over 300 million smartphone users across the continent. That's the scale of the impact we're looking at here. The ability to put a personal health companion into millions and millions of hands. And they have a clear plan to make it happen. After launching in Nigeria next year, the roadmap shows a strategic expansion into other key markets. Think Ghana, Kenya, South Africa. And after that, they'll move on to partnerships with governments and big companies. This is a plan built for continental scale. Which brings us right back to this huge final question. By connecting users, clinics, and pharmacies with intelligence that is truly local, Nyla AI isn't just building another app. It's building the very foundation for a healthcare system that's more proactive, more accessible, and way more intelligent for an entire continent.